Hi everybody. So we continue with the discussion on general pharmacology, and in this video we'll be dealing with bioavailability and bioequivalence. Bioavailability is defined as fraction of unchanged drug that reaches the systemic circulation. So when we give a drug, for example orally, it has to undergo absorption and reach the systemic circulation. So the fraction of drug that reaches the systemic circulation is the bioavailability of the given drug. We know that when we inject a drug intravenously, it directly enters the systemic circulation. So the complete amount of drug reaches the systemic circulation without a loss. So we can say that bioavailability of a drug injected intravenously is 100%. But when we give a drug orally, it has to undergo absorption by various mechanisms, and also it may undergo first pass metabolism. We'll be talking about first pass metabolism in a minute. So we can say that the bioavailability of a drug administered orally depends on two factors, that is absorption and first pass metabolism. When we give a drug subcutaneously or intramuscularly, usually there is complete absorption of the drug. But in case if there is local binding of the drug, then there is incomplete bioavailability in case of subcutaneous or intramuscular administration of the drug. Now we'll talk about first pass metabolism. It is also known as presystemic metabolism. First pass metabolism is defined as metabolism of a drug before it reaches the systemic circulation. So, if metabolism of a drug occurs during the passage of drug from site of administration to systemic circulation, then it is called first pass metabolism. This happens because there are many drug metabolizing enzymes present in the intestinal wall and liver. So when we give a drug orally, the drug will be exposed to these metabolizing enzymes and undergo first pass metabolism. This can be avoided by giving the drug through other routes, that is sublingual, transdermal or parenteral routes. Remember one thing, the extent of first pass metabolism is different for different drugs, and that is the determinant of bioavailability of the drug. So we have already said that bioavailability is dependent on two factors, that is absorption as well as first pass metabolism. Here you can see some characteristic features of drugs with high first pass metabolism. So these drugs, that is drugs with high first pass metabolism, oral dose is higher than the dose with sublingual or parenteral route. Also there is individual variation in oral dose. This is because the extent of first pass metabolism is different in each individual, and so there is individual variation in oral dose. We have already said that the first pass metabolism takes place in intestinal wall and in liver. So in case of liver disease, the first pass metabolism is decreased and thus the oral bioavailability is increased. Also, if there is another drug competing with it in first pass metabolism used concurrently, bioavailability of the drug is increased. There is a way to experimentally determine the bioavailability of every drug. So the way you do this is you plot the plasma concentration over time for both IV and oral dose. So first we're going to administer an IV dose here at time 0. And what's going to happen is, as you can imagine, the plasma concentration will shoot up very high and then it will steadily start to fall as the drug gets metabolized and eliminated. Then we're going to repeat this experiment and administer the drug orally here at time 0. And what you see is, when you administer the drug orally, you see there is a slow rise in plasma concentration. And this rise is generally not as high as the IV drug, because some of the drug doesn't get into the bloodstream both from absorption and metabolism, and over time the drug concentration falls. If you take the area under the curve for oral drug, see it is represented by the blue region here, and compare it with the area under the curve for IV administration, which is represented by the red region here, you can determine the bioavailability. So the equation is bioavailability equals area under the curve oral, which is generally the smaller number, divided by area under the curve IV, which is generally the bigger number, times 100. This will give you the bioavailability, which would be something like 50%, 60%, 20%, and that would be different for different drugs. That's all about bioavailability. Now we'll be talking about bioequivalence. So two pharmaceutical compounds are said to be bioequivalent when they have similar extent of absorption, that is similar bioavailability and rate of absorption. Oral formulations of a drug from different manufacturers or different batches from the same manufacturer may have same amount of drug, but they may not yield the same blood levels. This is because they are biologically inequivalent. Why do different preparations of the same drug does not give same blood level? This is because there is a variation in disintegration and dissolution rates. So what is disintegration and dissolution? Before an orally administered drug is absorbed, it should be broken down into individual particles of active drug. This process is called disintegration, and the force used in compressing a tablet can affect the disintegration. Also, the rate of dissolution is governed by its solubility, particle size, crystal form, and other physical properties. Any variation in these can lead to difference in bioavailability. So that's all about bioavailability and bioequivalence. With this, we conclude our session. Thank you.